Hi guys, welcome back to the channel. My name's Dr. Downey, and today we're going to be speaking about growth hormone secretagogues. I'm probably going to have to split this video up into different parts because there are a variety of compounds that could technically classify as a growth hormone secretagogue, and the first one we're going to go with is Sermorelin. Sermorelin is a growth hormone releasing hormone analog similar to that of CJC, and it is derived from the first 29 amino acids of the GHRH, or growth hormone releasing hormone protein. The reason it is that sequence of amino acids is because many different cells in your pituitary can be stimulated by various different releasing hormones, like or thyrotropin releasing hormone might be able to stimulate somatotrophs, which produce growth hormone, or inhibit prolactin production through lactotroph, and the same goes for growth hormone releasing hormone. So if we're going to use growth hormone releasing hormone, we don't want to have it stimulate other cells in the pituitary. So Sermorelin is administered subcutaneously and has quite a short half-life of about 10 to 20 minutes. The reason it's quite unique in the whole class of growth hormone secretagogues is because it works by mimicking growth hormone releasing hormone, whereas other commonly known growth hormone secretagogues like MK677 work through the whole ghrelin GHSR pathway. So in these videos, I'm just going to be looking at clinical data. There's a lot of in vitro and in vivo studies looking at the pharmacodynamics and pharmacokinetics, which I think is interesting, but I think it would take us too long to cover that. So let's see what it does in studies with humans. What are the results? So for children with growth hormone deficiency, Sermorelin was tried against recombinant GHRH, or growth hormone releasing hormone. And in this study, they did find that Sermorelin increased GH, or growth hormone, at a similar magnitude to GHRH. However, what they also noted was there was an acute small rise in prolactin, LH, and FSH. So, in fact, this 29 amino acid sequence wasn't more selective, according to this study. But the authors thought this might have interesting implications in hypogonadal men. And so, in a study done in rats, they took Sermorelin and gave it to hypogonadal rats, and they found that it increased testosterone. Now, what they wanted to do was replicate this in human trials. And the way it increases testosterone is through the elevation of LH specifically, but also FSH. So in a separate trial done by Corpus et al., they took 9 young men between 22 and 33 years old, elderly men between 60 and 78, and these participants were either given twice daily low-dose Sermorelin at 0.5 milligrams twice a day, or high dose, 1 milligram twice a day. This was quite a short study, but they did it over 14 days. What they found was what you might expect, and that is that the elderly men had a better response to Sermorelin, not necessarily achieving higher IGF-1 levels, but getting levels similar to their younger counterparts, and this was at a dose-dependent fashion. It increased the mean 24-hour growth hormone secretion and increased peak amplitude of growth hormone. However, this wasn't statistically significant in the younger, healthy individuals. What was significant, however, is that Sermorelin had an age-independent effect on waist-to-hip ratio. Essentially, they were using this to demonstrate fat loss. However, the study failed to show that the use of Sermorelin increased testosterone levels. It did increase, but it wasn't statistically significant. And what they concluded is that Sermorelin might be useful in the case of elderly men with lower than normal IGF-1 levels. So this study shows that perhaps it's not so useful in men with a healthy baseline, but there are other studies that would prove otherwise. In another study looking at elderly men by Vitone, they were given 2 milligrams of Sermorelin nightly for 6 weeks, as opposed to twice a day like with the other trial. And what they found is that the amount of growth hormone released over a 12-hour period was statistically increased. However, the peak of growth hormone did not change. And they never noted growth hormone release to be above physiological levels, whilst the increase in growth hormone release was higher than that of controls, and this period of increased or sustained growth hormone release lasted about 2 hours. And if you remember, the half-life of Sermorelin is quite short, about 10 to 15 minutes, so its effects outlive its half-life. However, unlike the trial that looked at Sermorelin at twice-a-day dosages, IGF-1 levels did not increase, which leads one to conclude that if you want to increase your IGF-1 levels with Sermorelin, you need to use it more often. Unlike the previous study, which showed a decrease in waist-to-hip ratio, there was no significant change in any of those body markers. The only thing that did increase was muscle strength. What is interesting to note, however, is there was a decrease in the mean systolic blood pressure. So this is the number above the diastolic. But all of these studies up until now had been done over quite a short duration. Karam et al. Decided to administer it to elderly individuals for a duration of 5 months. And what they did was, for the first 4 weeks, give them placebo and then give them Sermorelin at 10 micrograms per kilogram. And again, what they found in this trial is that growth hormone had a sustained release for 2 hours after administration of Sermorelin. However, again, there was no increase in pulse amplitude, so growth hormone levels never pulsated to a level above physiological, and the frequency of pulsatile secretion, the spikes of growth hormone, and how often they occur did not change. What they did note, however, is IGF-1 levels did actually increase, and this occurred 2 weeks after starting the drug and remained elevated up until the 12th week, and then started to decline. Now, they didn't really comment on why that was, since the drug had not been withdrawn at that point, but this might actually suggest downregulation of the receptors, which, contrary to testosterone doesn't have this effect, as I've described in a previous video, but this would demonstrate a downregulation of those receptors. What was interesting to note is fat loss didn't change. However, men had a significant increase in lean mass of 1.26 kilograms, and there wasn't much of a change in the women. What was significant in both groups is that they had an increase in skin thickness after 16 weeks, so at the end of the study. Again, they failed to demonstrate an increase in testosterone in these participants, which disproves the hypothesis they had at the beginning of development of Sermorelin. Insulin sensitivity surprisingly increased, and participants noted an increase in their libido. The side effects noted in all of the trials from Sermorelin were nausea, facial flushing, and redness at the injection site. And besides that, authors noted that it had a very favorable safety profile. However, we need more long-term data, like the study I mentioned at the end, in order to come up with dose recommendations and to find situations where Sermorelin might be of benefit. So if we summarize all the data we have, we can see that Sermorelin can be used twice a day. However, if used for a longer duration at night, will still increase IGF-1 levels, and these effects are significant in elderly individuals, and we've yet to have data show in younger individuals, like I'm sure most of you watching this video are, demonstrating a significant increase in IGF-1 levels. However, regardless of that, it would demonstrate that Sermorelin does increase the amount of growth hormone secreted for a 2-hour duration, never reaching above physiological levels. It doesn't really change peak amplitude of the waves or pulse frequency. And again, so far it shows a favorable safety profile. So let's try apply this to bodybuilders or anti-aging enthusiasts. Would you benefit from Sermorelin? Well, I'm not going to promote it, as I never do with any of the compounds I talk about. I just display the data and you can make your own conclusions. But again, I think it's too early to say yet whether or not Sermorelin has its place, since we don't have larger trials or double-blinded placebo-controlled trials yet demonstrating that it could be effective in certain clinical situations, but it could potentially result in an increase in lean mass and possibly fat loss, although only one study demonstrating this. And again, if you're young, it's probably not going to benefit you as much as if you were older, or of course if you are deficient in growth hormone. But I want to hear what you guys think about Sermorelin, if you've had experience with it, what your experience was, and I'll see you guys in the next video where we go over other growth hormone secretagogues.